Don't you hate it when your dentist uses confusing words that you've never heard before, like occlusion, atrophy, osseointegration? I'm here to help you kind of break down what those words are and give you some insider knowledge on what those words mean. Plaque, one of the most common words you probably even hear on TV. Basically, all plaque refers is the accumulation of bacteria on the surfaces of the teeth. A lot of times it hasn't been there for a long time, so it's very easily removed with brushing and rinsing and flossing. Plaque, when left for a long time on the surface of the teeth, can actually lead to bacterial decay and breakdown of the tooth structure because the plaque is a bacteria substrate. When added with the sugar from the diet you eat, will actually create an acid that erodes the surface of the tooth structure. So plaque in and of itself isn't bad short term, but you don't want to leave it on the surfaces of the teeth. That's why it's really important that you brush and floss at least twice a day, if not after every meal. Speaking of plaque, let's talk about tartar or calculus, and we're not talking about math here. Tartar or calculus is actually just hardened plaque. It's adhered to the tooth surface and is not going to be removed anywhere near as easily with brushing and floss. A lot of times if that calculus or tartar is adhered to the tooth below the gum line, it can lead to irritation of the gum tissue. And at that point, you really need a dental professional to go in there and remove that from the surface of the tooth to clear it off. Caries. I use this word all the time, but really all that means is referencing to a cavity or tooth decay. That's just the fancy terminology for a cavity. Prophy or prophylaxis, that's just our fancy word for dental cleaning. It's generally performed by a hygienist, and a prophy appointment generally takes about an hour. Scaling and root planing, that's just a deeper cleaning when you have calculus or tartar that's below the gum line that you can't get off with your toothbrush, and the periodontist or the dental hygienist has to do a much deeper, more involved effort to get in there and really scrape and remove that material from below the gum level. Occlusion, that's just our fancy way of saying bite. It really refers to how the teeth come together. So in an ideal mouth, the teeth are lined up in a very specific pattern so that the forces are distributed down the long axis of the teeth. And so when the occlusion or the bite is off, a lot of times those forces can cause damage to those teeth. One of the main areas where we see that is as we age, you lose a little bit of bone, and so those front teeth tend to start to shift and move, and all of a sudden the teeth are now hitting in a different occlusion or a different pattern than they were before, and you start to see lots of chipping and wearing down of those front teeth. Bruxism, that just refers to nighttime grinding. Kind of an interesting background on that. A lot of people aren't aware that bruxism is one of your body's first responses to try and get you to wake up. So bruxism a lot of times is tied to sleep apnea. So when your body realizes that you haven't been taking breaths, it'll cause you to clench your teeth and grind, bruxism, and that generally causes the body to wake up and cause you to kind of break that apneic cycle and take that breath of air. A lot of times patients that have sleep apnea also have bruxism, and bruxism is pretty easily treated with some kind of night guard or something to protect the teeth at night. So when the body does try and clench or grind, it's protected by a thin layer of acrylic. Attrition, that's just a fancy word for wear or breakdown. Now attrition typically occurs on the chewing surfaces of teeth, and generally most of the time where we see that attrition is on the front teeth. So you'll notice that in people that have kind of worn down older teeth, they're almost like flat. That's what attrition is. It's just the removal of that tooth structure from the grinding of teeth against one another. Filling. A filling is basically a tooth colored material that we put inside a cavity once we've got the unhealthy tooth structure removed and restore that tooth to its natural shape and size. A crown is a tooth-shaped cap that goes over the tooth and protects it from further breakdown. Impression. This refers to when the dentist needs to make a record of how your tooth is so we can correlate to the lab so they can make either a crown or a removable appliance, a denture. And in the past, impression used to be this big mouthful of goo that you'd have to sit there for 5 minutes and feel like you were choking. Nowadays, we've got the ability in most situations to take a digital impression. We have really in-depth cameras that can scan the mouth intraorally and record all that data, and we can send it digitally to the labs. Shade matching refers to the chairside technique of matching the exact color of your teeth so that when we have something made in the lab or when we do a filling, we can make sure it blends in and looks natural. And shade matching allows us to tell our lab exactly what we want that crown to look like. So that's just a small sampling of some of the words we toss around every day. I would love to hear in the comments below if you've heard dental terms or if you've heard something and aren't quite sure what it means. Reach out to us and let us know, and we'll let you know what that means. I'm Dr. Brett Langston. I'm a prosthodontist at Dental Implant and Aesthetic Specialists here in Brookhaven, Georgia, and I'm here to help you watch your mouth.
Down in Brookhaven, with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.